Okay, thank you all who are joining us today for our digital press event for the introduction of the READI Act and for the Disaster Relief Medicaid Act. We are so grateful for everybody who is able to be a part of this today. We do have the Zoom webinar happening here as well as a stream on YouTube. Both should be captioned. On YouTube, you are going to need to activate your captions if you haven't before, but we have the live captioning happening here on Zoom. I do need to let you know also that the video is going to be recorded so that you're aware. Okay, right now, everybody, participant lines will be muted. We are going to try to have a Q&A towards the end, but we will not be able to hear you if you ask questions verbally throughout the program today, okay? So we're going to go ahead and start off our day. We're really excited right now. We have our introduction of both the Disaster Relief Medicaid Act and READI happening sometime today. We've had tremendous organizational support. At last count, we had 116 different organizations signed on to support the READI Act. It's the 106 on DERMA. So it's been a really wonderful nationwide collective community effort to go ahead and get these bills introduced. So we want to thank you all for that. We're first going to open up having Marcie Roth go ahead and speak a little bit about this as a CEO for the Partnership for Inclusive Disaster Strategies. We know she's been quite the rallier behind getting us all together as a community to work on these issues. So we're going to go ahead and give it over to her.
Thank you very much. Good afternoon, and thanks to everyone for joining us from across the country. The Partnership for Inclusive Disaster Strategies is a national and global organization led by people with disabilities and emergency management experts with a singular focus on the needs and rights of people with disabilities, older people, and people with access and functional needs before, during, and after disasters. We're the nation's experts on disabilities and disasters. The partnership is the only membership organization in the U.S. with this mission. Our national footprint reaches every congressional district in the country and most communities. Today, we celebrate the introduction of the Real Emergency Access for Aging and Disability Inclusion for Disasters Act, READI, and the Disaster Relief Medicaid Act, DERMA. Passage of these bills will impact the lives of millions of people when disaster strikes and vastly improve emergency preparedness and the resilience of disaster-impacted communities across the country. READI and DERMA grew out of testimony delivered by Paul Timmons, board president of Portlight and founder of the partnership, back on September 20th of 2017, when he testified before the Senate Special Committee on Aging, led by Committee Chair Susan Collins and Ranking Member Bob Casey, just days after Hurricanes Harvey and Irma devastated Texas, Florida, and the U.S. Virgin Islands, and only days before Hurricane Maria wielded her catastrophic impact on the Virgin Islands and Puerto Rico. These hurricanes were later described by FEMA as having impacted 47 million people. It's widely agreed that over 12 million of these are children and adults with disabilities. These numbers are even greater when considering the disproportionate impact of these disasters on countless older adults and people with access and functional needs. In Paul's testimony, he called for the legislation that has now become READI and DERMA under Senator Casey's leadership, and now with Senator Collins joining. Paul told the committee, "Let me be very clear. Most of the failures and shortfalls we address are a direct result of the failure to plan at the local, state, and federal level, failure to place subject matter experts in leadership roles at every level, and failure to include people with disabilities and older adults as key stakeholders in planning efforts. This has been coupled with blatant disregard for the unwaverable civil rights obligations associated with the expenditure of every federal dollar spent by government, grantees, and contractors without any monitoring and enforcement by the federal government over its civil rights obligations." That was Paul's quote. Almost 2 years later, the results of these failures and their disproportionate impact on people with disabilities and older adults is starkly evident. There have been 122 major disasters in 2017 and 2018, and the outcomes for people with disabilities and older adults haven't improved. In fact, just last week, the Government Accountability Office released a report of their findings in response to a 2018 request from 17 bipartisan and bicameral congressional leaders. This report confirms what disaster-impacted communities already know. And the title of the report was, FEMA Action is Needed to Better Support Individuals Who Are Older or Who Have Disabilities. The National Council on Disability made a number of urgent recommendations in its May 24th report to President Trump. That report, Preserving Our Freedom, Ending Institutionalization of People with Disabilities During and After Disasters, included that Congress enact READI in Disasters Act, request a report from the Government Accountability Office to investigate whether past federal disaster funds have been used to ensure accessibility to emergency programs and services, that the Department of Justice provide pointed guidance to sister federal agencies to address the issue of outdated regulations that reflect what the Olmstead integration mandate requires. Address the issue of outdated regulations that conflict with the Olmstead integration mandate, and that the Department of Justice assesses the equal access and non-discrimination civil rights compliance of the American Red Cross and other shelter and mass care providers in relation to actions resulting in institutionalization of disaster survivors. If existing legislation were enough, FEMA, the Department of Justice, Department of Homeland Security, Department of Health and Human Services, and other federal agencies would be following their statutory obligations to disaster-impacted people with disabilities. Among these, HHS needs to cease their regularly issued waivers to states, allowing them to violate disability civil rights protections while refusing to work collaboratively with disability organizations, including those they fund. And FEMA, which has obligations under both the Rehabilitation Act and the Stafford Act, would cease denying equal access and reasonable accommodations to disaster-impacted people with disabilities and their reliance on volunteers and charity to meet their obligations. GAO, in their report, noted FEMA's need to provide reasonable accommodations processes, training, basic objectives for their new approach to meeting their obligations to people with disabilities in light of drastic and sudden changes in the middle of catastrophic disaster response. Further, despite Stafford Act requirements for the FEMA Disability Coordinator, who is required to consult with organizations that represent the interests and rights of individuals with disabilities about the needs of individuals with disabilities in emergency planning requirements and relief efforts in the event of a natural disaster, active terrorism, or other man-made disaster. Despite this, disability-led organizations are not consulted, and our attempts to work together are repeatedly thwarted to the detriment of disaster-impacted people with disabilities and communities across the country. And yet, FEMA relies on disability organizations to volunteer our services, make donations, and provide charity to disaster-impacted people with disabilities, routinely and repeatedly denied equal access to emergency and disaster programs, services, and other life-saving and life-sustaining resources. We are grateful for the leadership shown by all of the sponsors of these bills, Senator Bob Casey, Democrat of Pennsylvania, and Susan Collins, Republican of Maine, who will introduce READI, which is S1755 in the Senate, with co-sponsors Jones of Alabama, Blumenthal of Connecticut, Duckworth of Illinois, Harris of California, Hassan of New Hampshire, Gillibrand of New York, and Van Holland of Maryland. Senator Casey will introduce DERMA S1754 in the Senate with co-sponsors Brown of Ohio, Blumenthal of Connecticut, Gillibrand of New York, and Harris of California. READI will be introduced in the House of Representatives by Representative James Langevin, Democrat of Rhode Island, and Representative Chris Smith, Republican of New Jersey. DERMA will be introduced in the House by Representative Donna Shalala of Florida. We want to thank our partners for the contributions and expressions of support of hundreds of local, state, and national disability leaders, emergency managers, and our allies. READI and DERMA will create a national commission on disability, aging, and disaster, including people with disabilities, older adults, experts on disability inclusive emergency management, and government and community stakeholders to provide guidance on disability and aging issues before, during, and after disasters. Develop and deliver technical assistance, training, and research. Support funding opportunities for local disability organizations before, during, and after disasters. Provide uninterrupted access to Medicaid services when recipients must evacuate out of their service areas in disasters. Department of Justice review of ADA non-compliance settlement agreements in preparedness, response, and recovery efforts. Government accountability review of federal funds expended in disasters to ensure compliance with Rehabilitation Act requirements. 1 week into the 2019 hurricane season, we're already dealing with historic flooding in the central states, record numbers of tornadoes and wildfires burning in the West. Each of us has the opportunity to get involved in the passage of both of these important bills and to work together to enable every person to have an equal opportunity to be prepared and to receive the supports and services that they need in a disaster. Thank you all again very much for all of your support. And I'm now going to, in just a moment, turn this over to our next speaker. Our next speaker, Congressman Donna Shalala, is introducing the Disaster Relief Medicaid Act in the House. Congresswoman Shalala represents South Florida, newly elected to the 116th Congress and sworn in January of this year. I have to admit, Congresswoman Shalala is one of my personal heroes and a beloved champion of disability rights for many years. Her list of exemplars is long, but I will highlight a few. She began her career in public service as one of the country's first Peace Corps volunteers in Iran. In 1993, she was nominated by President Bill Clinton to serve as Secretary of Health and Human Services, serving for 8 years and described by the Washington Post as one of the most successful government managers of modern times. President Bush awarded her the Presidential Medal of Freedom, the nation's highest civilian award. She's been named one of America's best leaders by U.S. News and World Report, received the Nelson Mandela Award for Health and Human Rights, and she's been inducted into the National Women's Hall of Fame. I was also fortunate to experience her leadership as a parent when she served as president of the University of Miami while my daughter was a student there. Thank you, Congresswoman Shalala, for your lifelong commitment to public service and for your leadership on the Disaster Relief Medicaid Act. I'll now turn it to Congresswoman Shalala.
Thank you for the very nice introduction. But the heroes here are the leaders in the disability community and the aging community that have made it clear that people ought not to have to put themselves in harm's way because they fear losing their health care support and care. And this is another step towards making the healthcare system seamless, particularly for those with disabilities, when they have to leave their state and go to another state. And since there's full reimbursement on the other side, it ought to really give us an example of a mobile program that works for the community. I, of course, come from South Florida. We're used to hurricanes and flooding and other kinds of disasters. But whether it's flooding in the Midwest or fires in California, or there was an earthquake today in my own hometown of Cleveland, Ohio, but for the grace of God, each one of us could be impacted. So letting people know that they will access the long-term services and support through their home state's Medicaid program if they have to evacuate is probably, we're alleviating the number one stressor for people. States also will know that the federal government has their back when they provide shelter and assistance to evacuees, and that we're all in this together. And so I will be introducing today the Disaster Relief Medicaid Act, and I'm grateful to Representatives Langevin and the Senate sponsors Casey, Brown, Blumenthal, and Harris. I've also joined Representatives Langevin and Christmas today to introduce the READI Act. So both of these will be introduced today in the House, and we'll be working very hard to push them through the House as quickly as possible. Of course, there are hundreds of groups that support these, but again, I think it's the first step towards making healthcare seamless, no matter where you go in this country, but particularly through emergencies. So I'm delighted to be able to, during my first few months, help the community to take a strong step towards protecting those with disabilities, particularly during crisis time. Thank you very much.
Thank you very much, Congresswoman. We really appreciate your leadership.
Thank you so much. Okay, so we had our first big statement. That was wonderful to have Representative Shalala here with us by phone, so that's why you may not have been able to see her image. She was here by phone with us to provide that statement. We have a couple of other representatives who also sent in statements, but were unfortunately unable to be with us here today. So I'm going to go ahead and give voice to those statements that have been provided. The first one is from Congressman Langevin, who is our House sponsor for the READI Act. So I'm going to go ahead and voice some statements that he provided for us today. He says, "I'm sorry I'm unable to be on the call with you all today, but I wanted to thank you for your tireless advocacy on behalf of people with disabilities. When disaster strikes, no American should feel like he or she might be left behind or forgotten. This is why I am proud to be introducing the Ready for Disasters Act with my colleagues, Senator Casey, Congresswoman Shalala, and Congressman Smith. The Ready for Disasters Act will ensure that response efforts in extreme weather events, public health emergencies, and other disasters are inclusive of all people, including people with disabilities and older Americans. In addition to providing training and resources for inclusive disaster management, Ready for Disasters will ensure that people with disabilities have many voices at the table throughout the planning process. Thank you for all your hard work advocating on behalf of the Ready for Disasters Act, and I look forward to advancing this vital piece of legislation with you." So we want to, as a group, say thank you to Congressman Langevin for sending in this statement and for, of course, being our lead sponsor in the House on the READI portion. We also had a statement from Senator Casey, who I think probably most people on this call have at some point interacted with over the long time that we've been working on this bill, who also was unable to be on the call but sent in a statement. He is our lead sponsor for the Senate on both DRMA and the READI Act. So I'm going to go ahead and read now the statement from Senator Casey. He says, "Inadequate planning for disaster can mean life or death. So it is critically important that every community is prepared to meet the needs of all citizens, including older adults and people with disabilities, before, during, and after disaster strikes. I urge my colleagues to support the Ready for Disasters Act and the Disaster Relief Medicaid Act. We must ensure that seniors and people with disabilities are active participants in developing emergency preparedness plans that will keep them safe. So we want to say thank you to those three representatives, and in addition to our co-sponsors, and hopefully a lot of future co-sponsors that we're going to see after Introduction Day today. And of course, everybody who's been doing this work to get these bills to where they are today. We're going to go ahead and move forward with our program today with some of our partners and community members who have been crucial to this process. And we're going to start that off with Kelly Buckland, who's the Executive Director for the National Council on Independent Living.
Yeah, good afternoon, everyone. It's a pleasure to be here with you. I want to thank Senator Casey and Congress members Langevin and Shalala for their work on this legislation and for its introduction. Also want to thank the Partnership for Inclusive Disaster Strategies for all the work that they've done to get this legislation to where it is today. I'm the Executive Director of the National Council on Independent Living, which is a leading cross-disability grassroots organization run by and for people with disabilities that represents Centers for Independent Living, statewide independent living councils, individuals with disabilities, and other organizations that advocate for the human and civil rights of people with disabilities throughout the United States. We know that people with disabilities are the first to die and the first to be institutionalized and removed from their homes because of disasters. And that's why this really is a piece of civil rights legislation. And it specifically calls out Centers for Independent Living, which I want to thank the sponsors of the bill for putting this language in there. Centers for Independent Living, states and other covered recipients are encouraged to reach out to Centers for Independent Living, and they're specifically encouraged to contract with centers to help prepare for disasters, provide personal assistance during response and recovery, identify accessible shelters and adapt shelters to ensure that they're accessible to people with disabilities, provide accessible formats of disaster information, and include American Sign Language, and meet the needs for people with disabilities, older adults, and others with access and functional needs. Again, I want to thank the sponsors and the folks with the Partnership for Inclusive Disaster Strategies for including me in this today. It's been an honor, and have a great afternoon, everyone.
Thank you, Kelly, for that. So we're going to go ahead and move right on to another partner that has worked with us as we've been putting this together. We have Rebecca Cokley, the Director of Disability Justice Initiative at the Center for American Progress.
Hi, everyone. It is wonderful to be here today and to be here representing the Center for American Progress. CAP is thrilled with the introduction of READI and DERMA. And I want to take a moment to thank all of our colleagues at the partnership, all the sponsors of this incredible legislation. We know how long it's taken us to get here, and we are thrilled to be at this table with all of you, seeing this move forward. It is the commitment of the Center for American Progress to see disability policy weaved as a lens across all parts of the progressive agenda. And this legislation today is a critical example about why this in fact matters. You know, it's often said that natural disasters don't discriminate, that no single person is more or less likely than another to fall victim to a large-scale natural disaster. But as my colleague Kelly Buckland said, you know, the truth is that we die in these sorts of events. The disability community, particularly those living in disaster vulnerable places and in low-income communities, endure disproportionate harm when disaster strikes. And while we're at the beginning of hurricane season right now, let's be honest, the reality is that climate change has made predicting the weather by a date on a calendar pretty much meaningless at this point. We have to approach this with a mantra of constant vigilance. We never know when something is going to happen. And frankly, the noise of a White House intent on neglecting its responsibility to the health and safety of vulnerable communities during disasters, the ongoing price gouging we see around medication during emergencies, and the media spotlight that is there today and gone 30 seconds later serve to sort of detract from the opportunity we have to showcase the needs of the disability community as a national policy priority. I want to commend Portlight for taking leadership where other entities, including the federal government, should be and have frankly failed. And time again, let's be honest, we see the disability community, our siblings in these spaces stepping up to help each other. And to this point, they've been largely unable to draw down federal resources to assist in their efforts. And it's really exciting to see READI change that. I think one of the fundamental freedoms of this country that makes this country great is ideally the freedom to move about the country. And however, we know that until DERMA gets passed, that's not a reality for a large portion of people with disabilities that are impacted by this, by natural disasters. The fact that if you had services covered in Louisiana and you have to move to Michigan, they could say, well, we're sorry, you can't get what you need in Michigan, is frankly unacceptable. And I think as we think about the next steps of the ADA, DERMA and READI are a natural extension of the promise of the Americans with Disabilities Act. So CAP is thrilled to be here today. We'll have additional statements in the next few days coming out as well from folks on our team. But we are steadfast in our commitment to these pieces of legislation and to seeing these pieces of legislation signed into law. So thank you so much.
Fantastic. Thank you so much for that, Rebecca. So we have also a statement here that I will be reading from Helena Berger. She is the CEO and president for the American Association of People with Disabilities. She also had a very important meeting today, so was unable to make it. So I'm going to go ahead and read a statement that was provided from her. The American Association of People with Disabilities proudly stands with the Partnership for Inclusive Disaster Strategies, today's congressional sponsors and co-sponsors, and other disability organizations and allies to celebrate the introduction of the Real Emergency Access for Aging and Disability Inclusion for Disasters Act and the Disaster Relief Medicaid Act. READI's significance cannot be overstated. READI creates a national infrastructure that will ensure experts in disability, aging, and disaster are at the local and regional emergency planning tables. These experts will provide technical assistance and input to ensure people with disabilities' rights and interests are prioritized in the planning stages through rebuilding universally accessible communities. DRMA addresses a significant barrier faced by disabled people and other Medicaid-eligible recipients who must relocate out of their state during a disaster. It ensures people with disabilities will not experience an interruption in their health care and other Medicaid-supported services that are vital for individuals with disabilities to live independently in the community. AAPD is committed to advancing the rights of all Americans with disabilities, including during disasters. We support READI and DRMA as critical and innovative disability-led initiatives, ensuring a disaster framework that prioritizes the rights of the disability community and addresses the disproportionate hardships and life-threatening circumstances faced by disabled individuals in disasters. And with the increased frequency and duration of natural disasters, we urge Congress to pass READI and DERMA as swiftly as possible. So we want to thank so much Helena for that statement. And next, I believe we have on video Susan Prokop. She is the co-chair for the Consortium of Citizens with Disabilities Emergency Management Task Force, as well as the National Advocacy Director for the Paralyzed Veterans of America.
Good afternoon. Thank you for that introduction. As noted, I'm Susan Prokop with Paralyzed Veterans of America, and I want to thank the partnership and all the allied groups that worked so hard to get us here today. Today I am representing both PVA and the Consortium for Citizens with Disabilities Emergency Management Task Force, of which PVA is a co-chair. These organizations are delighted to support the bicameral introduction of the Real Emergency Access for Aging and Disability Inclusion for Disasters Act and the Disaster Relief Medicaid Act. PVA is the nation's only congressionally chartered veterans service organization solely dedicated to representing veterans with spinal cord injuries and disorders such as MS and ALS. CCD is the largest coalition of national organizations working together to advocate for federal public policy that ensures the independence, empowerment, and inclusion of children and adults with disabilities in all aspects of society. Like many other people with significant disabilities, PVA members experienced many of the failures of our nation's emergency management systems during and after natural disasters in the past several years. PVA members in Texas encountered inaccessible restrooms in shelters during Hurricane Harvey. In California, members lost their homes to the wildfires, then had to deal with excessive red tape to get assistance. And in Puerto Rico, poor coordination between agencies tasked with responding to disasters left many of these disabled veterans without any assistance in the days following Hurricane Maria. Among the PVA members on the island affected by the storm was one former Green Beret, William Rodriguez, whose home suffered serious roof and flood damage, and his family went without water or power for several months afterwards. As he recounted to PVA, quote, "I spent 3 weeks trying to get FEMA to respond, trying to get people from the state emergency office, and no one responded," end quote. Without the help they received from PVA's chapter leaders, these veterans and their families would have gone without the food, water, and other necessary supplies that are supposed to be provided to survivors of disasters. PVA and CCD support the Ready for Disasters Act because it will establish a National Commission on Disability Rights and Disasters to study the needs of those with disabilities during emergency and disaster preparation and planning, and throughout the disaster response, recovery, and mitigation processes. In addition, the legislation provides training and technical assistance to aid states and localities in involving and supporting people with disabilities during times of disasters. It directs the Department of Justice to review disaster fund spending by federal agencies and states to make sure monies have been spent in accordance with the ADA, and creates grants to pilot strategies for greater disability inclusion in disasters. We also support the Disaster Relief Medicaid Act. Because of the nature of the VA healthcare system, PVA members don't lose access to important healthcare services in the event they must relocate temporarily to another state in the wake of a disaster. In this respect, these veterans are more fortunate than the millions of people with disabilities who depend on Medicaid long-term services to remain independent and avoid institutionalization when disasters force them to leave their homes. The DRMA will ensure that these individuals are able to continue to access their Medicaid-supported services in emergency evacuations. And so finally, PVA and CCD want to applaud the authors and the original co-sponsors of these important measures, and we look forward to their swift enactment during the 116th Congress. Thank you.
Thank you so much for that, Susan. We are going to go over to some of our partners in the housing realm with Sarah Mickelson, the Senior Policy Director from National Low Income Housing Coalition.
Hi, thank you so much for having me. The National Low Income Housing Coalition is focused on ensuring that people with the very lowest incomes have access to housing that's affordable, accessible, and safe. 2 years ago, when Hurricane Harvey was approaching Texas, we started our Disaster Housing Recovery Coalition, again, bringing together partners in Texas, Florida, Puerto Rico, California, and beyond to focus on how our federal housing recovery after a disaster, how that reaches the lowest income people. We found that after disasters, the lowest income seniors and people with disabilities are often left behind. The programs that we have in place are ones that are not designed to serve their needs, and as a result, many of them are left in a worse position than before the storm. They find it harder to get back on their feet. We're really proud to be supporting this bill and other bills that look at the systemic and ongoing challenges at FEMA and to make sure that their programs are centered around people who have the greatest needs after a disaster. We look forward to working with everybody to get this enacted and also to urge Congress, in addition to passing these bills, to look at other ways to hold FEMA accountable to make sure that its programs serve everyone. Thank you.
Thank you very much, Sarah. Next, we are going to hear from Norman Smith. He is the chair of the New Jersey State Independent Living Council. He is going to be voiced today by colleague Maggie Leppert.
Hi, my name is Maggie Leppert. I'm going to talk for Norman Smith today. Greetings from New Jersey. It gives me great pleasure to speak on behalf of the New Jersey Statewide Independent Living Council in support of these two bills being introduced today. 20 years ago, the NJ Office of Emergency Management started outreach to people with disabilities. In those 20 years, emergency planning involved people with disabilities has evolved to where the idea is not novel or unusual, but implementation and the practice varies greatly around and by state. In my state, for example, some counties are very inclusive and supportive, while others are still learning what inclusive means in practice. The READI in Disasters Act will change this by focusing a bright national spotlight on the issue through funding research and by creating a national commission with people with disabilities, older adults, experts, or disability-inclusive emergency management and government and community stakeholders to provide guidance on disability and aging issues before, during, and after disaster. After New Jersey was hit by Superstorm Sandy, many of my colleagues from our 11 Centers for Independent Living worked in disaster recovery centers assisting those with disabilities. One of the biggest issues they dealt with was the fear of people with disabilities being forced into institutions because they lost their homes. The Disaster Relief Medicaid Act will prevent this in several ways. The one that I like to highlight is funding of grants to help states develop an emergency response corps to provide home and community-based services to keep people living in the community. New Jersey has made attempts to address this issue, and a planning grant will make this happen. Without this legislation, people with disabilities will continue to die in and after disasters in far greater numbers than need be. We need to stop these needless deaths now. Thank you.
Thank you so much, Maggie and Norman. Sorry about that. I was having a little bit of technical difficulty as expected for these kind of events. And so next, we would be remiss if we didn't include some of our partners from Puerto Rico. So we are going to have Carol Salas, who's going to speak with us today. Carol is the director for the Instituto de Deficiencias en el Desarrollo, or the University Center for Excellence in Developmental Disabilities in Puerto Rico.
Hello. Hi, everybody. Good afternoon. Thank you for the invitation. Can you hear me? Okay. First, I want to thank Marcie and also the partnership and all the sponsors that have made this process through. As the moderator said, I am Carol Salas. I'm the Puerto Rico USAID director. Puerto Rico is located in the principal region for hurricane development in the Caribbean. As global warming advances and extreme weather events become increasingly more common, this legislation is extremely urgent for us. As you may know, Puerto Rico is considered the purest jurisdiction in the US. 48% of our population lives under poverty levels. 22% of our population has been identified with having any type of disability, and 30% of our population is 65 years or older. So half of our populations are on a vulnerable state for any emergency disaster. It is imperative that people with disabilities and at least adults of 65 years or older be included in all the aspects of emergency planning, disasters, and recovery responses, including people with disabilities in the territories. This legislation, which is inclusive, finally, for the territories, could make the difference to ensure the well-being and the lives of the American citizens that lives in Puerto Rico in the events of future disasters. So we are very hopeful, and we thank you all for the efforts and the help that you have brought to Puerto Rico. Many thanks.
Thank you very much for that. And then lastly, we want to open it up to Herman Parodi. He is part of the Partnership for Inclusive Disaster Strategies. He is our disaster response team lead, also a member of PA Adapt, and was part of our deployment team to Puerto Rico. Herman, go ahead.
Thank you, Valerie, and thank you, everyone. I want to personally, and as the disabled community, thank Senator Bob Casey for taking the lead and being our champion in introducing, again, the Rio Emergency Access for Aging and Disability Inclusion for Disasters Act, READI, and the Disaster Relief Medicaid Act. One of the first things we need to be doing now, again, it's getting more co-sponsors and educating our community. So the READI number in the Senate is S1755, and for DRMA is S1754. And for the House, being a person living with a spinal cord injury, I am so empowered by the leadership that Representative James Langevin has taken in introducing the READI for Disasters Act in the House. And as a member of ADAPT, and knowing how much now Congresswoman Shalala remembers us and supported our community when she was in the administration, it couldn't be a stronger representative to introduce the Disaster Relief Medicaid Act in the House. For us in ADAPT, these two bills are historical in knowing that disabled people will now be at the tables evaluating and proposing and implementing the regulations and standards needed for our communities to survive the ongoing disasters. Right now, as Rebecca Cokley said, hurricane season has started, and the fires are hurting people already in California. And just this morning, as Congresswoman Shalala said, the earthquake in Ohio, unexpected, unaccounted for, and people are not, the systems are not ready for the masses, even less for our community. And with the RMA, as Medicaid follows the person in disasters, we see it with a full federal support for the next 2 years after that. It is time that these bills are introduced. This is the time to get them passed. Please be on the lookout for our emails and information on what to do next, how to get your communities involved. We will get these bills passed. We're ready. Thank you for introducing. Thank you for being here today. Valerie.
Thank you so much, Herman. So we are going to go ahead and turn it over for some Q&A. We've been getting some questions from press through a Q&A setup that we have. So we're going to go ahead and let Stephanie Heidel, who is our Portlight Fellow doing media, take that. Any future questions that you might have, she will also be the contact for that. She'll share a little bit about her information and get some of these questions answered, and then hopefully we can take that away and start working on some of those next steps that Herman brought up as far as taking these bills as they've been introduced, getting that support locally and at the federal level, and getting these bills passed so that we can make sure that we have inclusion in our practices for people with disabilities and older Americans. Stephanie?
Thank you so much for joining today. And I'm going to get started with the question, why do we need this legislation? Isn't accessibility and access to disaster services already legal requirements? And that is for Marcie.
Thank you for that question. Yes, there are already legal requirements. The Rehabilitation Act was passed in 1973. The Americans with Disabilities Act was passed in 1990. The Stafford Act has been amended several times. So there are, in fact, many civil rights requirements already in place. However, these bills will ensure that monitoring and implementation of those civil rights obligations actually occurs, and that people with disabilities, older people, and people with access and functional needs will benefit from those protections in disasters. There are no waivers to civil rights in disasters, and yet, unfortunately, without monitoring and enforcement, we see again and again that people with disabilities, older folks, and many other people do not have equal access to the programs and services that they need in order to be able to survive disasters. So READI will provide training and technical assistance centers across the country and research dollars to identify good and promising ways to improve services and supports in disasters. And there will be opportunities for both the Department of Justice and the Government Accountability Office to take a look at previous and current implementation and the expenditure of federal funds, which are required to be in compliance with equal access obligations. In 2017 alone, there were $300 billion worth of hurricane and wildfire-related costs. Many of those dollars, most of those dollars, were federal funds, and so passage of READI will provide an opportunity for a good hard look at whether those funds are in fact being spent in compliance with the obligations of the Rehabilitation Act.
Thank you. We have another question following up on the HHS and the waivers. So you mentioned HHS issuing waivers to states. Where can we find information on these waivers and in our states?
There are several places to find the waivers. First of all, on HHS's website, when they issue these waivers in disasters, they're posted. You will also see in the recent report issued by the National Council on Disability that there's significant coverage of those issues as they were as they came to the surface over the 2018 disasters, with those waivers issued in a number of states: California, North Carolina, South Carolina, California, off the top of my head. And if the person making that request needs any assistance, the Partnership for Inclusive Disaster Strategies is happy to provide you with both that information and a complaint that we filed in September of 2018, in which we addressed the difficulties with those sorts of waivers and the conflicting message that those waivers send to states when the federal government has made it very clear. Department of Justice in 2007, the Department of Homeland Security, and other parts of HHS have all made it very clear that there are no waivers to civil rights obligations, and that people with disabilities have a right to be served in the most integrated setting appropriate to their needs, including in disasters. So We did file that complaint. Unfortunately, we were only granted a listening session by DOJ. We were not provided with any additional follow-up, and so we're happy to provide that information if folks would like to learn more about that.
Thank you, Marcie. We do have a few more questions. So the next one is Disaster Relief Medicaid Act. Does this provide new healthcare access in disasters?
Is that for me too?
That can be for you, yes.
Okay, so no, this does not provide new health care. In fact, it makes it possible for people who are eligible for Medicaid to be able to continue to receive the health care that they're already entitled to, even if they are required to evacuate out of their service area. As it stands right now, if a Medicaid recipient, Medicaid eligible individual has to evacuate out of their service area, Medicaid doesn't cover their costs. It doesn't cover their health care, doesn't cover their home and community-based services. The impact of this is felt not only by those individuals, but in the preventable healthcare costs of acute conditions that develop when people are unable to maintain their health in disasters, and as well the significantly higher costs of institutionalization when the home and community-based services that those individuals would otherwise be receiving are interrupted.
Thank you. And on to the next question. Aren't these bills very expensive, both the READI and DRMA? Thank you, Marcie. I'll have you take that.
Okay. So aren't these bills very expensive? Well, first of all, the cost of civil rights protections is never a consideration. People have civil rights protections, and this is not an area in which cost is a consideration. That being said, that we also know that the cost of not addressing the civil rights of people with disabilities, older folks, and others is far more expensive than assisting those individuals to receive the services and supports that they need to optimize their health, their safety, and their independence.
Thank you very much, Marcie. We have a question from the audience, someone who, and this is what she wrote. My name is Lindsay Sullivan, and I am a resident in a nursing facility. I am curious if there is anything in the present bill that is applicable to the nursing facilities policy of trapping people who have disabilities in their rooms when disaster strikes.
So this is Marcie, and I will also address this one. And Lindsay, first of all, I would encourage you to contact us or let us know how we can contact you so that we can make sure that we connect you with folks in your community who can help you address this for your particular situation. However, there was a rule issued by the Centers for Medicare and Medicaid about 2 years ago that requires that all Medicare and Medicaid reimbursable facilities, including long-term care facilities, nursing facilities, that there are a number of things that they are required to do in order to prepare for disasters and to ensure that the folks that they serve have their disaster-related needs met. We would be very happy to discuss that with you, help you to educate yourself about what your rights are and what the responsibilities are of your facility. And then if you're interested, we would really welcome your active participation as a partner in this process, because your voice needs to be at the table, and we can support you to address those needs. And I see that Lindsay, you're also asking, does this include fires? And the obligations under the emergency preparedness rule is it includes any kind of disaster. And again, we really welcome the opportunity to work collaboratively with you to not only make sure that your specific needs are being addressed, but that folks can learn from your experience so that other folks will also receive the support that they require, regardless of where they happen to be receiving services.
Thank you very much, Marcie. And the next question we have, is it reasonable for people to expect their civil rights will be intact in a disaster? And that can also go to you.
Could go to me, although I'm going to actually put Herman on the spot. I wonder if, Herman, if you would address that question?
Thank you. Stephanie, could you please repeat the question?
Sure. Is it reasonable for people with disabilities or anyone to expect their civil rights will be intact in a disaster?
Thank you, Stephanie, for repeating, and thank you for who asked the question. At this moment in time, do not expect your rights to be protected as a person with disabilities in disasters and afterwards. For the past 2 years, our rights have been violated time and time and time again in preparedness before disasters, as standards are being implemented during disasters through evacuation and response and recovery, and certainly after disasters, as they are not including our stakeholder communities in the discussion tables. However, now when these two bills pass, specifically READI, it has a lot of provisions to make sure that our rights that have been around in disasters for 30 years are protected, are enforced. It also gives the organizations that work to ensure and protect our rights the resources to, to tell you the truth, we all know we need to be the ADA police. We need to now make sure that we have the resources to be the disaster, people with disabilities and aging communities, not only police, but providers. We will have the resources and the legal updated and amendment in cases, protections and rights to be enforced in disasters once READI and DRM are passed.
Thank you very much, Herman. And one more question from the audience. There are many people with disabilities that have service dogs. Problem has been in the past that shelters do not accept service dogs, therefore causing extreme anxiety and trauma to the person with a disability and a service dog. What will you do to fix this problem?
I will take that one. This is Marcie. And the shelters are required to accommodate people with disabilities and their service animals without exception. We have been working with the American Red Cross and other shelter providers, local emergency managers for years. Despite this, every disaster, we hear stories of people who were turned away from shelters, or there were attempts to separate people from their service animals, and the passage of READI would provide both an important strengthening of the enforcement of legal decisions, legal orders that have previously been issued around this, and would also support training, technical assistance that may also provide some additional strength to the enforcement of these obligations. And at the same time, each of us in our local communities needs to get involved in preparedness and making sure that in each community there is no question about the obligation to provide access to individuals and their service animals. We need to participate in exercises. We need to make sure that our friends and colleagues who have service animals are actively involved in preparedness and in exercises. And with the development of regional training, technical assistance, and research centers, these will become opportunities to invest in stronger local enforcement. Additionally, READI identifies some very significant language around the opportunities to contract with local disability organizations such as Centers for Independent Living, which are experts in this area and who can play a very important role in educating the whole community about accommodating people with disabilities and service animals across the board in meeting their needs in the most integrated setting appropriate to their needs, which in almost every case in a disaster is going to be the same shelter that anybody else goes to.
So thank you, Marcie, for answering those questions. And we are at the top of the hour. So thank you, everyone, for attending today's press conference. I'm available for additional media questions at media@disasterstrategies.org. You can always email as well with additional questions, and we will respond to you as soon as we can. So thank you, everyone, for joining today.
Thank you, everybody. Now, get your congressional delegation to sign on and get all of the organizations in your community to join as organizational supporters of these bills. Thanks, everybody.
Thank you.